welcome everyone. We're sitting here in an evening in Florida, and it's a beautiful day here in sunny Florida. We're having a great time learning a lot about integrative health and working on our businesses as well. And so we're very excited to be doing that. And here you can see I'm here with Dr. Tim, and Dr. Tim is from Arizona, and we met at the conference about a year ago now. Yeah, a little more than a year ago. And so, yeah, I get so excited meeting everybody here at these conferences because everyone's so focused on longevity and health and kind of hacking the norm. And so I'm very excited to welcome Dr. Tim on the call today. So
thank you.
I'll let you introduce yourself.
Yeah. Hey, everybody. I'm Dr. Tim Harrigan. I've basically been obsessed for 25 years, finding the root cause of health issues. And I created my natural healthcare office, and we get along so well because, when you dig into research and kind of the real facts about how to be healthy, it's usually almost sometimes the opposite of what we're told and the dogma that we create, that we're told through our TV commercials and just kind of the mainstream. So I've always had a gut feeling that there's different, better ways out there. So I've been obsessed for 25 years. I was just telling you a little while ago, I haven't been to a traditional doctor. No offense against doctors, of course, but I haven't been to one in 25 years. My wife was actually told she would never have children because of her PCOS and endometriosis. After I started working on her health, we got pregnant for the first time 6 months later. So imagine a woman that doesn't think she can get pregnant from the medical model. They tell her maybe a 5% chance through in vitro, and we get pregnant the first time, and we're in our 30s. So we're like, well, shoot, we better, how many kids do we want? Because we can get pregnant now. We didn't think she could. And we have 4 kids now, and our 4 kids have not had a Tylenol or over-the-counter prescription, none of that stuff in their bodies. So my office, and the reason I bring that up is it's my obsession. I want to optimize my health. We were just talking about lifespan versus our health span.
Yeah.
We can live, quite a long time sometimes, but if I don't remember my name for the last 10 or 20 years of my life, or I'm not capable to go enjoy my hobbies, like what's the point, right? So we talk about health span at these events, and just, we're rubbing shoulders with the top longevity docs in the world. So it's really cool, really confirming a lot of what we do already is really better than a lot of these other good systems out there. So my obsession is finding root cause methods to live a long time.
And so today's topic of the webinar is talking about hormones and longevity and how it relates to heart disease. And when we talk about heart disease, we're going to talk about again today is that, cholesterol is not the culprit here. And it makes me sad when I hear conventional doctors still, go to the cardiac conferences every year, and it's all about lowering cholesterol as low as you can, and get, how low can you get? And you're making minuscule benefits with that side of things. And so really what our focus is that, cholesterol is not what causes heart disease, but then when we take cholesterol lowering pills, it affects heart health and hormones. And hormonal imbalance could be a culprit, is the reason why you end up with cardiovascular disease in the first place. So this is why I'm so excited to talk about it, to test, to get the right testing, and to even focus on treatment options that we're going to get in today. So I'm going to, without further ado, I know we're all longly waiting here, so let's get started with the presentation, and we're going to go through the importance of improving that side of things. We just got to share screen. Yeah. All right, well, there we go. So we're going to get started here and talk about, obviously, as the HeartFit Clinic, you're concerned, you're frustrated, worried about your heart health, and we can see you on any part of your journey, whether it be trying to prevent that first heart attack to, I've got a problem here. I've got some warning factors here, like high blood pressure, diabetes, high cholesterol, maybe, and getting through, even maybe you got some markers that you're kind of concerned about, to then people that already have heart disease. And when we talk about heart disease, it falls into 3 different pillars. It could be electrical related, which is atrial fibrillation. It could be, that's the brain talking to the heart. There are a lot of factors that can be affected on that side of things. And then there's the structure of the heart. We're going to talk about heart function and heart failure and that type of thing as well today. And then it can also be talking about then the plumbing, right? The plumbing of the heart, but arteries are not a pipe. That's my whole big thing and spiel, is that arteries are a muscle. They're not a pipe. And it's not cholesterol that accumulates to this pipe, and you have a a last burrito and you end up with a heart attack. It doesn't happen that way. So anyway, this is why I'm really excited to be talking with Dr. Tim about hormones and heart health today.
Yeah, preaching to the choir
Yeah,
just constantly. So thank you for having me again. I just want to just cover my butt, so to speak, right? This opinion is, frowned upon by a lot of people. We get a lot of pushback from certain doctors that are just that are locked into that dogma. So I just want to make sure everybody knows this is meant for informational purposes only. It's not meant to diagnose, prevent, treat, or cure any disease. Mostly the opinion of myself, and please speak with your healthcare provider regarding any changes.
of course.
Anything else you want to add to that?
No, it's at the Hartford Clinic, we're always looking at finding the best ways to help you with your heart health, and there's a reason why we have Dr. Tim on this webinar as well. So,
And the funny thing is, I've gotten into this philosophy, like, I don't want to treat something on myself. If you treat something, you're not really addressing the cause to that thing, right? You're
yeah,
hopefully minimizing it. When we see like an RA commercial, they say at best, take this medication, you might lose your arm, your vision, right? All these crazy things that it just don't make sense to me. But then they say it might help your RA with 20 to 40% of your symptoms. Like, we just talked a little while ago, it's at what cost to the body, right? We get so focused on symptoms and feeling good, we don't ever look at the root cause, which requires more advanced testing and things like that.
of
So
course.
now hormones are the feel-good molecules, I call them, because
Yeah,
if your hormones are off, you're not going to sleep good, you're not going to have energy, my bone health, my muscle health all go away, your brain health is controlled by hormones. So it's a really important discussion to tie hormones into heart health because, again, specifically because of cholesterol, which will make a lot of sense here shortly. So I just always ask permission when I do webinars, especially to people I don't know yet. I'm going to be myself. If you guys can raise your hand if that's okay. I get very passionate about these topics. Again, I've been finding these solutions for 25 years, and we get a lot of pushback from that.
yeah,
But when I see something work hundreds, if not thousands of times with people, I don't care what anybody else tells me. I see it working every day, helping people, right? So if it's okay, I'm very direct. I was telling Diamond earlier, I'm very direct, but I promise you I'm not disrespectful. Every person on here I care about, even though I don't know you. Our purpose, I think, just being in this group too, the whole group's purpose is to change healthcare and help more people and help people get their life back and their quality of life and their
of
energy.
course.
And
Yeah.
I can't do anything. I can't get a promotion at my job. I can't hang out with my kids. I can't enjoy my hobbies. Like, your health is your number one priority without a doubt. So if it's okay, I'm going to be myself here and kind of let you guys have it.
Well, I mean, I just wanted to start off by talking. I know Dr. Tim wanted me to go through some of this stuff, but optimizing testosterone naturally, so many cardiovascular benefits.
Keyword naturally.
Yeah, naturally. And it's, it'll help with blood pressure control, help with even diabetes control, right? Like, it's all about understanding what more you can do with this side of things. And so there's just so many important benefits that happen here. And when we go through this side of things, there's, you can just Google this: low testosterone and heart disease. It's increased risk of diabetes, increased risk of high blood pressure, increased risk of cardiovascular disease. And so I just want to, I'm not going to harp on this. Everyone will get copies of this video afterwards. And so we really want to prevent low testosterone and even low T. Everyone's heard about that with the commercials and all that. We know it's at increased risk. And so the cardiovascular benefits that come from optimizing testosterone is huge. And so when you start to give therapy, you help improve ischemia, you help improve exercise tolerance, you improve insulin resistance. There's so many things that happen with this. And so there's just a bunch of things that happen. Obviously, dilates the arteries, improves blood flow, reducing artery stiffness, which is a big cause of heart attacks. And so a lot of great long-term studies of having heart health on that aspect of it. And then natural methods of improving testosterone, like exercise and dietary changes, has been around forever. We know the benefits of that. And we know that if we were to bottle up this in the form of a pill, that would be the most prescribed pill in the whole world. It wouldn't be, statins and, Viagra, for example, which is where it is. And now GLP-1s are looking at being the next level of doing that side of things. And I don't know if we'll have time to go into that, but anyway, that's another thing. So just a quick summary table. Obviously, low testosterone increases your heart attack risk. Obviously, increase your risk of death. And there's a lot of things that can happen when we start to do this. So, I mean, here's all the literature and studies behind what we're talking about when we talk about testosterone. So we're very excited to be talking about those side of things there today. And you can see, I mean, again, lots of Google and lots of studies on there. Low testosterone in men linked to chronic diseases. And so if you have nothing to be grateful for, check your pulse. And that's always important to be, you're here today. What more can you do to be able to go through that? So I'll let you.
Absolutely. And now that kind of, I think people know the, conviction of why testosterone levels are important. It's not about injecting thousands of doctors at the anti-aging conferences, longevity, biohacking conferences. And a lot of the people I met with these crazy numbers, they still don't feel good.
Yeah.
So, but the reason we show this research, right, is it's clear. Research knows that you have to have optimal testosterone levels to really feel good on almost all levels and systems in your body, right? Yeah. So the importance hopefully is ingrained in everyone. But now we're going to find solutions that are the better solutions than maybe what we're offered, right? So again, my family, this is what I live and breathe. My practice was literally designed around my own obsession with what do I want? What do I need to, stay healthy with supplements and diagnostic tests? So everything has been wrapped around that. All of my team members, they're incredible. They've all been patients for years before they come work with us. But just understand, I show this quickly because I want you to understand this is what I live and breathe every second of every day with people. And we've just gotten better and better. So again, I haven't been to a medical doctor in 25 years. I have a lot of biohacks that I do. I take many different supplements, one of them being Vascanox that we've talked about, nitric oxide health. There's so many different kind of key areas that we want to keep working on, especially if somebody has a weakness in their history, right? If every male in my family has died of heart disease or whatever, that's something that's a tendency now in my life. So I want to exercise. I want to eat extra healthy compared to my family members, right? And as you know, genes are not a death sentence. They're a predisposition. They're a tendency to something. The epigenetics is really what we're talking about here. It's what environment am I putting my body in every day to either feed or inhibit me.
Sorry, we're just gonna make sure we're properly there. So
I need to share again, or we're good?
Yeah, we're good. Yeah.
Okay. All right. So top 4 leading causes of death. You guys have probably seen this somewhere: heart disease, cancer, medical intervention, and actually medications. Okay. So this is really the premise of kind of why we do what we do. I want to find other options so I don't fall into those top 4 leading causes of death in the US, which are really 90% preventable, right? And some people even say more than that. So I want to find other options because these are great options if I have a crisis situation or whatever, right? There is a place for drugs. There is a place for surgery, but I want to find ways to prevent those or at least delay those a really long time. And this is scary. When you understand literature, people base everything on studies and, there's a research article or an article that tells me to do something, take zinc or vitamin C. Yet only about 15% of medical interventions are supported by medical evidence. That's kind of scary to me. When I look at that system, I assume 100% of it is the best science, the best way to do things in the world. And when you start digging into it, going down that rabbit hole, we found out maybe it's not. So testosterone, women and men know I'm talking to you. So women, I start with women first because we have been told that women have estrogen, men have testosterone. This is bogus. This is untrue. It's a myth. I'm going to show you some slides that'll help you understand that. But testosterone function in a woman, and men, I'm talking to you as well, enhancing libido, muscle development, bone health, brain health, skin collagen, vision, like literally testosterone molecules affect the health of our overall body. It is so important to keep it optimized. And a lot of women these days have too much testosterone because of insulin resistance and other variables. And that's why PCOS or fibroids are so prominent now. So I just want you to understand this is the #1 hormone, women. You need to focus on balancing before the estrogen, before the progesterone, and that'll make more sense here shortly. So a lot of women can't explain what's going on in their body, right? My wife gets foggy brain sometimes. Women complain about being fatigued or chronic fatigue or sleep issues or just not feeling good, right? Because again, hormones are the feel-good molecules. And the mainstream solution is usually estrogen, hormone replacement therapy, right? Birth control for even really young women now, right? Just to control their hormonal symptoms, but at what cost to the body? So a lot of women, they just can't explain how they feel. And with women, their hormones are a little more volatile than males, so it gets even more complicated. But when I focus on fixing this problem in women, which again, they can't explain many times, I have to work on their testosterone first every single time before we look at the other hormones. Because again, the influence of testosterone in your bodies, ladies, affects everything. So men, you already know this discussion's for you. I'm not gonna beat the dead horse, right? Because you understand this is already around males, but women, you've been lied to. This is just as important for you as well. So got low T. So the goal isn't to force those numbers really high. Most people get a total blood work, total testosterone. Most people are low because of all the hormones and hormone disruptors in the environment, toxins, stress. Most people are low. And the business model behind that is, well, here's your prescription, right? That's how they raise it up. But what that does is it has side effects in the body. I don't want a crazy high number. In America, more is better to a lot of people. More is not better per se, right? Better is better. Testosterone balance is really the key here. So don't think what we're talking about is trying to boost your levels really, really high. It's the balance, the synergy of how all those molecules are working together. That's the important thing. The cholesterol myth, right? Again, you talk about how we get measured our cholesterol, no other tests that are root cause based. It's high. Here's your prescription.
Yeah.
That model is too simple. It's a business model for TRT, for cholesterol. It's not addressing the root cause. So when we do tests, right, we want to dig deeper. Like, what are your adrenal glands
And this
doing?
is what we talk about in our clinic. We talk about, look, cholesterol, there's hundreds of things. So inside the artery wall, of course, no talk goes without me saying that these arteries are muscle. They're not a pipe. And inside the artery wall, it's got this lining of skin called the endothelium. And so that endothelium gets damaged. There's hundreds of things that can damage that endothelium. Cholesterol is not even one of them.
Mhm.
And so, yeah.
The analogy I've heard, which I really like, maybe you'll disagree with this, but blaming cholesterol for plaquing of arteries is like blaming the firefighter for the fire that he's trying to put out right now.
Yeah. There you go.
So it's there, but it's not the cause of the problem, right?
Of course.
So we need cholesterol. You guys probably know this at this point from your training. Cholesterol is and throughout our whole body, all our cells. What percentage of our brain is cholesterol? 20 to 30%.
Yeah.
But sex hormones, remember, hormones are the feel-good molecules. There's almost nothing else in your body that will make you feel as good as balancing hormones. It doesn't exist. Insulin's a hormone, but vitamin D is even a hormone. So when you balance all these hormones, you feel better, you sleep better, and just overall vitality. So it's so important. So low total cholesterol is associated with high total mortality. This is, again, not our opinion. This is from the European Heart Journal. But the reason cholesterol is important, you guys, it is.
So here's where we get a little geeky, but
Yeah.
you've dumbed this down a little bit. So,
yeah, for sure. And so, but cholesterol, if you look at the top of the chart here, you cannot create, if you look lower down, testosterone, estrogen, or any other hormone in the body without first starting with the molecule called cholesterol. So if I'm on a statin or a drug that blocks cholesterol production from my liver, right, you cannot produce hormones. This is literally the starting block. It's the foundation to the home. Without the foundation, I cannot build the home. So your hormones are not created without plenty of cholesterol in the body. So this is so important. One of the most common things I hear when people get on statins as patients, they get impotency really quickly. They start, losing some of their memory. They start having higher blood sugar and A1C levels. Like, it literally throws off everything in the body because cholesterol is essential in almost every cell of the body.
Well, and sometimes people are taking statins or cholesterol-lowering pills, but it's understanding that if that's the case, it's important to address the nutrients and the other things that get imbalanced with taking that medication. So,
which are,
a whole bunch of micronutrients that get affected. And if you start to deplete certain micronutrients, that will affect another biochemical pathway with diabetes, for example, or with something like inflammation, or it can affect different pathways. And so I think it's important for those people that are taking a cholesterol lowering pill, we don't want you to come off of it. That's not the goal here. But the idea is to find out, well, if I'm going to take this, number one, I don't think you need as high of a dose of what they've been prescribing. That's number one. But number two is then addressing the imbalances that come from it, such as what we're going to be talking about today.
Absolutely. And that's micronutrient testing, right? Doing the right test to identify those blind spots, because we all have different blind spots. So we won't beat this into the ground, but I want to show you guys, women, I'm talking to you right now. So this chart, if you look off to the left here, this is the amount of a hormone, right? So the higher up you go, the more hormone you have. On the bottom is your age, 0 to 62 years of age. So what does this mean? The blue line at the very bottom, basically at 100 or below, that is your estrogen levels. That is your estrogen levels from age 0 through 62. See how they drop down, they come up, and then they drop down again later in life. The point of this is, look at the green line above that. That is your testosterone levels, ladies. That is actually a more dominant hormone every phase of your life. you have more of it than estrogen every phase of your life than estrogen, right? It's so important to fix this. Again, this is brain health, bone health, all the things that we have been told estrogen is actually important for. It's actually testosterone. We have to fix that before I even worry about our patients' progesterone.
Because most people are talking about, well, we need to be taking estrogen because of that risk of heart health concerns that happen on that side of things. And so we start to do these things and we end up going through that part of it. It's really about addressing testosterone first rather than getting right to estrogen that way.
Absolutely. And that's what I've been doing for 3 years now, and it's been a game changer. I could show you testimonial after testimonial from women. And this is why they believe that. This is really, I know a lot of doctors and just lay people that this is where this myth comes from. Okay. So guys, if you look at this chart here, this is estrogen on the left here. So normal levels of estrogen in a woman are 30 to 400 picograms per milliliter. If you look at the chart on the bottom here, this is testosterone levels in a female. Now it says 15 to 70, right? So what it looks like is this 30 to 400 looks like a much bigger number than 15 to 70. That's not the case though. If you see that this is in picograms per milliliter versus nanograms per deciliter, right? This is like comparing millimeters to inches. And that's why you saw earlier, this is why our testosterone is more. When we look at normal lab work and you're not familiar with these measuring increments, it does look like estrogen is more dominant. This is literally where that myth comes from. No other reason. It's people don't know how to read these measurements, essentially. Testosterone insufficiency in women, it's absolutely true. There's lots of articles and urology publications, School of Medicine. I want to talk about hormone replacement therapy and birth control. This is kind of crazy. You don't see these articles on the mainstream news or publications very often anymore. Don't ask me why. But in 2005, they classified the World Health Organization basically birth control and hormone replacement therapy as carcinogens. Okay. So there was a study that came out. Let me skip to which year this was. 2007 was a lawsuit that was won. But basically there was a period of time, I believe the report came out in 2003, 2005. So when this report came out, there's about 200,000 women because they were talking about the side effects and adverse reactions from HRT, hormone replacement therapy, or birth control. A lot of people saw that, right? When we had less TV stations, 200,000 women stopped taking their hormone replacement therapy or birth control. The following year, okay, a year later after these women stopped taking that, there was actually 14,000 fewer women diagnosed with breast cancer. So it was from 2002 to 2003. So that report came out in 2002, 200,000 women stopped taking hormone replacement therapy or birth control, and they had 14,000 fewer diagnoses of breast cancer the following year. So those reports are out there, you guys. They're not necessarily safe. They do have side effects. This is one of them, Premarin. A lot of women have heard of these hormone replacement therapies. This is worstpills.org, by the way. This is a third-party drug evaluation company, research company, and they have a black box warning on these types of drugs, hormone replacement therapy or birth control, endometrial cancer, uterine cancer, and otherwise. So I hope that makes sense. So again, I want to find ways to balance hormones that don't come with all these costs to the body potentially, right? So toxins are a big part of this. We are exposed to so many toxins. They're hormone disruptors, insulin response. We eat more carbs and sugars than ever in history. Now, there's a lot of reasons why this happens, but these toxins are everywhere. They're in our food, they're in our air, water, and we're not chemical deficient, right? When you look at any drug, 99% of them are synthetic chemicals, right? Are we actually chemically deficient in our incredible human body, or are we nutrient deficient, right? Our soils are depleted. We're getting too many chemicals. So I would say it's the opposite, right? We have too many chemicals. We don't have enough nutrients. Even from really healthy foods, they're so depleted now. We want to start changing that ratio. So adding more drugs to my lifestyle is not going to help that per se.
Of course.
So there's an epidemic in men and women, and I want to call it more of a testosterone imbalance because some women have really high testosterone levels, and that's a problem as well because of the insulin resistance. So it's more of a testosterone balance epidemic. In men and women, it's getting worse over time. It's a very big industry now, and we call it menopause and andropause. And so I've had patients that we balance their hormones, and they thought they were going through menopause, and then it got delayed 5 or 10 years, right? Their body wasn't ready, but because of the that environment they had, the toxins and their insulin resistance, they started going through that earlier.
Yeah.
And it wasn't time for them yet, right?
When you put your body in a position to heal itself, it does.
Yeah,
And that's so important.
Yeah, absolutely.
Yeah.
And it's kind of weird sometimes to people. They're like, well, I didn't ask for this. It's like, well, your body wasn't ready. I don't know what your body's going to do once you get healthy, right? But things are going to function better. And so the impact of low T is decreased libido, erectile dysfunction, mood swings, fatigue, muscle loss, weight gain, sleep disturbances, cognitive change. Like, do we know anybody around us that doesn't have half of this list, right?
Yeah.
And this is a normal fluctuation of testosterone through a male's life cycle. So around 20, we peak. And for the rest of our life, essentially, it drops down and down and down. Now, this is an old chart. In the time we're in now, from 30 years ago, even 20-year-olds are having low testosterone these days. So this chart is even worse now because of our environment, because of, the foods we're eating now versus even 30, 40 years ago. But this is a normal kind of trend. We have a lot and then we decrease over time. Women, here's your testosterone. You actually peak in your 30s and 40s, and then it starts tapering down. Why were we ever told estrogen for women, testosterone for men? This is just as important in both of us. We have slightly different ratios, sure, but it's just as important. And here's the ratios. So when you look at free testosterone, let's talk about this for a second. When you get most hormones measured from, maybe insurance coverage, cover some labs for my hormones, they measure in the blood a total testosterone or total estrogen or total progesterone. Of that total testosterone, though, there's a lot of little things in there that matter. Your total doesn't tell you how you feel. We think more is better, though, right? So if we look at free testosterone, that's only about 2. If you have a big bubble here, a circle, only 2 to 3% of that. This circle represents total. There's about a 2 to 3% sliver that's called free testosterone. Everything we've talked about as to why low testosterone causes chronic diseases, as to why you have optimal levels, you feel better, you don't age as quickly, that's based on free testosterone. So we have to get this total idea out of our head first. Let that go. How much free testosterone is in my body, my wife's body? That's what now determines my brain health, my bone health, muscle mass, energy, sleep, and all those. So when you look at free testosterone in men and women, women are the pink line here and men are the red line. There's really not that big of a difference between men and women's free testosterone when you look at it this way.
Yeah.
So why are we told estrogen for women, testosterone for men? It's very profitable. That's my opinion. It's a massive market. It's growing quickly. And again, kind of like cholesterol, it's too simple. It's low, so here's your prescription. I can't fix your body by giving your body something that's not producing.
Yeah.
Right. And when you give the body something it should be producing, you shut down that system even more.
Yeah.
So it's very,
and it happens often where even in our clinics with patients coming in to see us, I got my doctors, and we're not hormone replacement clinics. Like that's not our focus. I mean, we send that off to other people. And the idea behind this is that when you look at that, people are taking creams and they're taking all these different things, pellets, they're compounding, all these different options, they don't feel better. And that's
isn't that the point?
Yeah.
So if I'm not even feeling better, I don't want those extra side effects, right?
Yeah.
Common side effects, right? This is testosterone pellets. You guys can Google this. Acne, mood swings, changes in body hair, sex drive. You actually create a lot more need for other medications with these drugs. People get on the anti-acne drugs. They get on the PDE5 inhibitors, the Viagra's, right? Even though my testosterone's high, those people have erectile dysfunction many times.
Yeah.
So it's crazy what comes along with this. Cardiovascular issue side effects, right? Reproductive side effects. So it's really just not fitting into what we're told happens when we increase that total number really high with a synthetic way to do that. Chest pain, shortness of breath. This is all FDA from the FDA here. Testosterone use. This is again worse pills linked to increased heart attacks. You guys can find these over and over and over again. Now, topical testosterone, like you mentioned, is even more harmful because now when I put this on my body and I have kids and I have my wife, it transfers to them. So there's actually an FDA black box warning on these creams because you're touching everybody and giving them testosterone now, right?
Of course, yeah.
And they may not need it, obviously. Testosterone therapy in men, more evidence of blood clots. You guys get the point. But the reason I show this slide is because a lot of women are on pellets now and TRT. I see a lot of women going this route and they feel better, usually for a short time. But if you're worried, women, about getting those negative side effects that you don't want, like getting manly features or deepening of your voice or facial hair growth or enlargement of the clitoris, menstrual irregularities or blood clots, don't get on TRT, right? Because that's what happens when you force high amounts of testosterone in a female's body versus letting her body do it naturally through food molecules and exercise.
Yeah.
So you don't want these side effects. So the sooner you get on that TRT, these things will most likely develop over time the longer you're on it. There's a lot of articles comparing these different systems and administration methods. We can get you these articles to read in more detail. I just want you to know they do exist. And I have patients that tell me all the time, they're like, well, I don't get my hormone replacement from my doctor. I get them from the compounding pharmacy.
Yeah, and it happens often.
And they think
Yeah.
that's better, right?
Yeah.
So female replacement hormones may someday be remembered as the most recklessly prescribed and dangerous drugs of this century. This is bioidentical hormone replacement therapy. And if you look at this, women should refrain from using bioidentical hormone replacement therapy made by compounding pharmacies. Again, this is a third-party drug evaluation company because they have not been FDA approved or tested for their safety.
It's just important to look at who's doing and how's doing what, right?
Yeah.
Yeah.
So they think it's safer, and many times it's less regulated, actually. So even bioidentical, and we have this happen a lot. So people say, I'm not on synthetic hormones, I'm on bioidentical. There's not a big difference, to be honest. When you give the body a hormone, it should be producing, it shuts it down, and you have side effects, acne, hair growth. Men get kind
I
of
get excited
promiscuous.
about the biology behind this side of things. I know it's
Mhm.
coming up here soon,
Yeah,
but yeah.
absolutely.
Yeah.
So, but the main point is the reason I would not get on TRT long term is because I don't want to shut down my body system. I see people do great with it sometimes for 1, 2, 3, 4, 5 years, and then they start getting side effects and they stop being able to gain muscle and lose body fat. They get a lot of acne. They're tired. They have foggy brain, but their number's like 1,000 or 1,500. Well, the sooner you get on hormone replacement therapy, the less your body will remember how to produce it, right? So if I'm already struggling, if I have a low testosterone number and I give the body testosterone, my brain has a negative feedback. It says, hey guys, we have enough testosterone today. Now my organs shut down, my adrenal glands. This is why men's testicles shrink. It's use it or lose it. If my organs aren't being used because I'm giving it to the body, they will get weaker over time. So now I'm worsening that problem, eventually having a bigger problem to deal with by shutting off my own system. So that's the main reason why we never give people something their body should be producing just for a short-term band-aid.
Yeah.
So what if there was a natural, effective, clinically proven, and affordable solution to help support abnormality in women and men? That's what we're talking about. We're finding solutions that move the needle, right? That help me get healthier without all of those crazy side effects. Nobody wants those. And I think we do it out of, fear or desperation sometimes, right? But there are options out there. You just have to find the right people, which we're a huge group of people with a lot of these solutions. And it works incredibly well. So Synergy, we're going to talk about some of the mechanisms. This is 100% natural, zero synthetics, all food derived. There's not even any herbs in here because sometimes herbs have interactions with medications and other herbs and stuff like that. So this is literally, I tell people, every ingredient in here is literally safer than your last restaurant meal.
Yeah.
Right? When we go to a restaurant, we eat a steak and all these different things. There's so many chemicals and seed oils. Like there's nothing synthetic or unnatural in this whatsoever. And it's minimally processed so we can keep the bioavailability of those plants. So you won't find more certifications. This has NSF certifications, informed ingredient. So I show these to people because when we start talking about hormones and all these mechanisms, they start like pulling back a little bit, like, oh, I don't want to mess with my hormones. Not realizing every bite of food they have every day, the amount of sugar they have and a bunch of other chemicals is helping or hurting your hormones already.
Yeah.
That's already happening with every bite of food you have. So what if we have something that's standardized, that's safe, that's been studied to be safe and effective to work on some of these mechanisms for me? Just makes sense, right?
Of course.
So
Yeah.
you won't find anything else in the world that has this many clinical studies, certifications, efficacy on earth. It doesn't exist. And that's why I partnered with this biotech company. So we're creating basically doctor products, things that move the needle, but that don't have the side effects. And so I just want to share this real quick. So this is mostly fenugreek seed derived molecules, right? The seeds are powerful. The story of seeds, they create all life. They grow, an acorn becomes an oak tree, a sperm and egg meet, and it grows into a human, right? There's so much power in seeds. It takes us 30 pounds of these raw fenugreek seeds to pull 1 pound of these special molecules out. To understand, this is food derived, right? That's why we say that. But it takes us we only get 1 pound out of this 30-pound batch of raw fenu seeds.
Yeah.
These molecules are what we've been studying for 30 years.
So we can have these fenny seeds on our own and try and improve it on our own, but we're going to have 30 pounds of it.
That's right. Yeah. And that's the other thing. You
Yeah.
can't just eat a bunch of fenugreek or eat these seeds, right? It's 1 pound. It's very
pull out the thing that's
specific molecules,
No,
exactly,
for
that
sure.
we've studied.
Yeah.
And so that's what we're talking about. That's what's in Synergy. And you guys already know that food is powerful, right? We've all heard of aphrodisiac foods, right? These exist, right? When we have, oysters and these things, we know those are aphrodisiacs because they have certain hormone mechanism effect on the body.
Yeah.
So I show this because, again, that product is food. It's food derived, natural, organic. And it just scares people when you start talking about hormones and these mechanisms. I'm scared of the side effects of hormone replacement therapy and TRT. Don't be scared of something like this. Again, the last bite of your meal was much worse. This has several mechanisms. One thing that it will do is it works in 10 hours, first of all. Essentially, when you take this at bedtime, we all release hormone the next morning, okay? So let's go over that here shortly. So one thing it does is we do have studies showing it does work in 10 hours. It doesn't work that quickly. Now, what I tell patients, right, is don't compare this to TRT. Don't compare your turmeric product to an opioid, right? They both help with inflammation, but I can't compare the two. People say, well, is that turmeric going to help as much as that opioid? Well, that doesn't make sense. That's the wrong question. They both help with inflammation, but you can't compare something natural to a synthetic, right? So it works in 10 hours, but it's also steroidogenic. Don't let that word scare you. Steak is steroidogenic. Exercising is steroidogenic. It's just meaning you're getting the body to produce the hormones it needs, okay?
Yeah.
So these molecules are steroidogenic. That's why if somebody has a really low testosterone number, typically in the future, if you retest them, it's going to come up a little, sometimes a lot. Everybody responds differently. That's what steroidogenesis means, which is the opposite of TRT or pellets, right? Because that is anti-steroidogenic. That shuts down my body's production. That's not what I want to do. I want to get my body producing those things again that I'm lacking.
Gotcha.
That's what steroidogenesis means. It's also spermatogenic in men. We have lowest sperm counts in history. But there's 3 other mechanisms which are really cool. So again, this isn't about just forcing testosterone high, which this won't do anyway. It's going to bring you up to healthy levels, but it's not going to keep forcing it up to crazy levels. So 2 things that happen when we have a lot of testosterone, especially the people that are on TRT, but this happens with people with PCOS, men with prostate issues, hair loss in men and women. We get bad molecules that come from an excess of testosterone. And let's look at.
I want to go back there
Yeah.
a step, just because when you talk about, the production of testosterone, this is what it's doing. Now, it won't let me produce more testosterone than is needed as well.
Right.
Right.
Mhm.
So that's number one. And then it talks about vasodilation, and everyone knows the benefits of dilating the arteries. And then I see the PD5 inhibition. I know we got some other slides on that. Can you just
Mhm.
quickly talk about PD5 inhibition?
Sure.
And what that is equivalent to, just for
Yeah.
our listeners?
So a lot of people have heard of the Viagra's, the Cialises.
Yeah.
Those drugs are designed to work on one thing in your body, kind of like a cholesterol drug. It stops your body's production of cholesterol, right?
And then this is why then this works such in combination with improving nitric oxide production,
Absolutely.
which is Vascanox is
Mhm.
what we recommend for
Yeah.
our listeners that way. So
So in combination, those 2 natural products are just so powerful.
yeah.
I mean, if I have better blood flow, better nitric oxide, better oxygen transfer, that's only going to help all of my organs, right? That's only going to help my hormones and things function better. So blood flow is the river of life, right? So when we improve both of those, it's very complementary.
Yeah.
So PDE5, people know of the Viagra's and Cialises. Those are called PDE5 inhibitors. That's what they do. They inhibit PDE5 production in my body.
Mhm.
So Testosterone, we have clinical studies showing it's also been clinically studied to be a PDE5 inhibitor. We're going to show you some side effects from Viagra's and Cialises. I don't want those side effects. If I can do this naturally through dietary changes or powerful supplements, that's what I want.
Yeah.
But this also inhibits 2 other bad molecules. There's one, so when you have testosterone in the body, a lot of your testosterone can convert to dihydrotestosterone.
Mhm.
I don't want to get too scientific, but I want people to understand what this is.
I think you have a
Dihydrotestosterone.
slide coming
Yeah.
up though.
Mhm.
Yeah, maybe we'll
You wanna
hold
cover
off
that
on-
soon?
Yeah.
Okay, sure.
Yeah.
But these are all the cool mechanisms this one ingredient has, right?
Yeah.
The synergy of that in the body is so important versus forcing cholesterol low, testosterone high, right? Those are working on one mechanisms at a time.
Of
Your
course.
body's complex. We need to work on several things for the synergistic effect of actually making it last. So more is not necessarily better, like we talked about. Better is better, and that's what this is. We want hormone balance,
And
not
this is how
crazy.
complex the body is.
Exactly.
It's a slide that is very complex, just to show you how many biological chemical reactions that happen in our body. I mean, I love this slide because this is stuff that we get to geek out on. But
And this
yeah.
is just metabolic pathways. So
Yeah.
in the human body, this,
Yeah.
most people don't understand. We have 30 billion trillion, understand that number, chemical reactions in our bodies per second. If it was 1 million chemical reactions per second, the smartest people in the world wouldn't even understand what that means.
Mhm.
It's 30 billion trillion. So you can't take one thing out of this complex human body that's miraculous at healing when we give it the right things. You can't just affect my total testosterone and get healthy, right? It's so dynamic getting healthy, eating healthy, exercising. It's so dynamic and synergistic what we have to do.
Yeah.
And there's really three things that happen in that complex body. We're either lacking something, we have too much of something, or even imbalance. It's really that simple, even though it's very complex in the body. This is what we can test and fix in the body. And this is what your yearly labs do. It's just not super comprehensive at doing that. That's why you guys have extra tests that you do.
Yeah.
This is the blind spots you want to identify in the body. And that's why we use food molecules in our supplements. So sex hormone binding globulin. This is a little bit of science for people, but this is very important. You know, we talked about the total testosterone. That's this full blue circle here. The free testosterone, again, is the important discussion. I want to keep my free testosterone levels in healthy, good ranges throughout every phase of my life when I experience stress and just life in general, right? So that's the important one that gives us all those benefits from testosterone. The reason this works in 10 hours, TestoSurge, we all release 100, let's say, just for analogy purposes, every morning we release between 7 and 10 a.m. most of our testosterone for the day, men and women.
Yeah.
7 to 10 a.m. we release, let's say, the number of 100 testosterone, okay? When you release that 100, 60 of it may get bound to this thing called the SHBG we were just talking about.
Yeah.
So if I release 100, but 60 goes over here to SHBG, I'm left with 40 because you cannot get any of that 60 back. When your testosterone binds to SHBG, it is forever gone. So if I create 100 and release 100, I only have 40. That's not very efficient. That's not going to really help me with energy, fatigue, sleep that day, right? Now, there's two other bad molecules. One of them is called the DHT, dihydrotestosterone. This is linked to prostate issues and PCOS in women.
And what happens if that number is low? And these are exactly those conditions that occur.
Right. Well, when this gets too high, yeah, in excess.
Yeah.
Yep, exactly. So when we have too much DHT, men and women start losing their hair. A lot of people on this call may be losing their hair, maybe because of DHT. The PCOS, the fibroids, those are caused by excess DHT, right? And so estrogen is another one. We don't want a female's testosterone of that 100 to convert through aromatase to estrogen. That's a bad molecule. So let me go back to the original. I release 100, I lose 60 forever, I have 40. 10 goes to DHT, right? I have 30 left now. 10 more goes to estrogen. I'm left with 20 of my own testosterone out of 100. That's not very good.
No.
And now I have two other bad molecules in excess floating around in my body. So this is a normal stressed human being. That's what's happening. They're left with 20 of their own testosterone. TestoSurge, the reason this works in 10 hours, when you take 2 of these at bedtime, you go to sleep, those molecules from fenugreek, safe molecules, bind to SHBG for me. They compete for the same receptors as your testosterone does. So we're not giving people testosterone with TestoSurge, right? What we're doing is we're binding to SHBG. So when I release my 100 in the morning, I have 100 to use because it can't get lost forever.
Yeah.
These locked into that. So that's the power of the TestoSurge.
So that's a bonus 60 right there.
Yeah.
Yeah.
So I've got 60, right? And that's also a DHT inhibitor through our clinical studies and an aromatase inhibitor. So when I release my 100, I'm not creating bad molecules. I'm not losing a lot forever.
So I save 80.
Save 80.
Yeah.
Well, really 100, yeah.
Well, now we got all, I can keep all of it. That's the idea.
Yeah, but what we're doing is optimizing your own natural hormones.
And this is not like, yeah, I know you got studies and it happens like very quickly within a day. Like you can see really big changes.
And I hate telling people that, right? Because then they think it's.
I know, but, and I don't like telling that either, but I just want to, like, this is a long-term, like it's something that your benefits come in about 2 to 3, maybe 4 months kind of.
Yeah, I won't let a patient start on this unless they're willing to do it for 3 to 4 months.
Yeah.
If they do that, 19 out of 20 will stay on it.
Yeah.
But some people, they get a result after their first dose. I don't like telling those stories though. That's not realistic. If I change my diet for one meal, right, and I ate like garbage before, there's nothing miraculous going to happen. So when you use natural approaches, if I exercise one time, right, I have to do it for months.
Yeah.
But once you start building those patterns with these safe molecules, it really starts to kick in 2 to 3 months later.
Of course. Yeah.
So it's safe. Again, it helps me inhibit some of the bad guys and it binds to where I lose my own testosterone. We do have all the studies. We can get these to everyone. But again, we're not making this up. This is all clinically studied. This study shows this does work in 10 hours. Like I mentioned, if you took 10 tonight and we measured you tomorrow, we did this at a bunch of the doctor shows, longevity, anti-aging conferences. We had a few skeptical doctors come up and thinking we were making up some of this research.
And that's just looking at total right? So
Yeah.
that's just looking at total testosterone with blood, right?
Yep.
So yeah,
So we would test these people, and sometimes they'd be at a level of 100 or 150, which is very low.
yeah,
And we'd say, well, let's see if this works for you.
of
Take
course,
two
yeah,
tonight and let's test you again tomorrow.
yeah,
Every single time, Diamond, they were at least 50 points higher the next morning. They're like, okay, I believe it works. Let me buy a bunch, right?
yeah,
So, but that it does work quickly, but don't expect it to work that quickly. Give it time,
of course.
just like an exercise program, but it always does pretty miraculous things. Steroidogenesis, again, already doing this. This is through that cholesterol creation. Our cholesterol converts to these testosterone molecules, progesterone, estrogen. It's so important to have healthy cholesterol levels in the body for this. Again, we have all the studies showing this. There's lots of different types of hormone therapy. I don't know if you want to talk about this.
Yeah, and I think uh, anybody who's on low testosterone will be given one of these five options. I think that's the idea. And it's really of the comfort of the practitioner who you end up seeing, right?
Yep.
So oral are pills, there's sublingual, transdermal, we talked about that. It goes right onto the skin, injections, and then pellets. And so can you maybe just comment on each one of those as the pros and cons with that? Obviously, the pros is we increase the
Yeah.
testosterone.
The con is really the same. It's just
Yeah.
an administration method, right?
Yeah.
I'm giving my body, whether it's orally, through my skin, through an injection, through a pellet, which is a minor surgery, by the way. I hate pellets the worst because if you put a pellet in your butt, they literally make an incision, put a pellet in, sew you back up. I don't want to get a surgery to get testosterone placed in my body every 4 to 6 months. That's insane to me. So, but what happens is now it's up to my body to absorb what it's going to absorb. How do we even regulate the dose?
Yeah.
They give me the full dose for 6 months. They put it in my body's going to break it down and absorb it. Could be a lot today, a really crazy excessive amount. Tomorrow, maybe not so much. So even that is just harder to monitor, right?
Yeah.
But regardless, all of these are giving my body a hormone that I actually want to teach my body how to produce again, right?
Gotcha.
That's steroidogenesis. They're
Yeah.
all taking away, the brain shuts down those organs over time. Again, these are steroidogenic foods, so don't let a supplement, we're talking about steroidogenesis, scare you. These are all foods that increase steroidogenic activity in the body to make us healthier. DHT, this is one of the bad molecules that is converted from our own testosterone. So picture all of that 100 of testosterone, and then some of it, 10 of it goes to DHT, right? I'm left with 90, now I have 10 dihydrotestosterone. This dihydrotestosterone in excess contributes to prostate issues.
The DHT is too low.
You want to balance, right? And that's the cool thing with food, right?
Yeah.
I don't want to use a synthetic thing that's going to force something really high or really low. I want to balance with food molecules.
Yeah.
But yeah, you can have too low, but usually medication is going to do that, right? Because we're actually absolutely forcing it down with a, sledgehammer versus natural means. And PCOS, like I mentioned earlier. So a DHT inhibitor is a category of drug, just like an aromatase inhibitor or PDE5 inhibitor, like the Viagra's. All three of those drug categories are designed to help you inhibit one mechanism. That's it, right? If I can find something like Testosterone that does all of that magically through food, that's what I want. I don't want to just try to pick one thing at a time to work on in my body. That doesn't make sense. But these drugs, people get on them for hair growth, prostate issues, PCOS symptoms. There's a prostate that's swollen on the right there. A lot of the common names are finasteride, dutasteride. And guess what? These drugs do not use drugs according to worst pills because they have a lot of side effects. And in fact, it's crazy, the side effects. We'll get into Viagra side effects too. We kind of have a joke about that, but all of these drugs working on one mechanism at a time, no matter what mechanism, whether it's forcing the testosterone in my body, inhibiting DHT aggressively, inhibiting aromatase aggressively, those will always have side effects, and I'm only working on one mechanism at a time. So again, I want the optimization. I want all of these things happening. My body's creating more if I don't have enough. I'm helping my body produce more free testosterone, which makes me feel better, more bioavailable testosterone, which helps you feel better, while inhibiting some of these bad guys that have a lot of crazy side effects. So this is clinically studied to do this. It does inhibit 5-alpha reductase, which is the DHT inhibitor, and aromatase, which is the estrogen inhibitor. So we can get those studies to people. Aromatase, what is it? It's basically when, again, a female's testosterone, if you look to the left there, it converts into estrogens. And those estrogens are literally creating tumor growth for breast cancer. So we don't want that to happen, right? So this is why a lot of women
to block that.
exactly, that have maybe a tendency to breast cancer, they put them on aromatase inhibitors, right? And they have crazy side effects that we'll go over here shortly. But that's the one goal. It's like, I don't want my wife's testosterone to convert to estrogen. That's really the goal from that. A lot of people have seen these drugs, especially women, and from worse pills. This is actually an FDA black box warning, because it can actually create a lot of issues, these tamoxifens and stuff. And again, we're not giving medical advice. However, the more information we have, the better decisions we can make for our daily habits. So symptoms of high estrogen in men. So a lot of men's testosterone also converts to estrogen. It just creates different issues. Erection problems, belly fat, loss of lean muscle mass, water retention, gynecomastia, all these different things that are hormone disruptors in the body. We don't want a bunch of our testosterone converting to estrogen in
Just
men
to be
or
clear,
women.
gynecomastia is growing man breasts. So that's the.
Yep. It's very common now.
Yeah,
our
yeah.
environments are so disrupted.
And that's why it's so important to block that estrogen even in men, right?
Yeah.
And so we want to have it, but we don't want to convert that way. And
yeah. There's a lot of chemicals in foods and restaurant foods that actually promote that more, right?
Yeah.
So I want to inhibit that with certain foods versus the other. So again, the studies are here with all this stuff we're talking about. This is the 5-alpha reductase study, so we can share those charts if you kind of want to geek out on some of this. The spermatogenesis, this is one of the clinically studied benefits. Men have the lowest sperm counts in history. Women, don't worry, you're not going to start creating sperm. There's analogous, benefits in men and women because we have slightly different body parts that have converted differently right when we're born. But spermatogenesis is basically just, there's certain foods that do this. There's certain lifestyle habits that do this, but the testosterone is also spermatogenic. So we can't claim that this product did this for some of our people, but we've had about 4 or 5 pregnancies in our office over the last year that kind of gave up on it. This is one of the things I put them in. Now, I can't claim that that's what happened, but when I'm working with them and that's one of the changes we make and they're exercising and they have been for a while, it's like,
well, that's good to see.
Cool. Yeah, absolutely. Again, I doubt this got them pregnant, but all these little things that we do to balance our hormones is obviously powerful. Spermatogenesis is basically the creation of sperm in men. It's constantly happening. It happens in the Sertoli cells of the body. And there's reasons for worldwide decline in male fertility. It's mainly stress and toxins. And again, same things why women have hormone imbalances, all these environmental factors. A solution they give most men now is for low sperm counts is clomiphene. This is a drug. It's kind of like TRT, but slightly different. You get an increased risk of blood clots, visual disturbances, gastrointestinal issues, skin reactions, mood changes, gynecomastia, like we talked about. So you may be working on one mechanism, maybe my sperm count goes up, but again, what costs the body? It doesn't seem like a good option for me. And again, it will help women to some degree, right? There's analogous differences with eggs versus sperm, but we all have similar parts, just slightly different as to the development of this. So most people have seen this, the Cialis, the Viagras. These are called PDE5 inhibitors, like we've been talking about, right?
Yeah.
So this is a scary statistic. I don't know what it is in Canada. In the US, this is erectile dysfunction, basically, where we have 63 million men that always have it or almost always have erectile dysfunction. You can see how much bigger that category is than any other category. It is such a massive problem. It's such a lucrative industry to sell PDE5 inhibitors to people with side effects. Then you have 16 million that usually have erectile dysfunction, then another 12 million that sometimes, and there's 6 million out of these 90 million here that never have it. That's a very low percentage of normal functioning men. That is not healthy or normal, right? The market is growing massively. I don't want this issue, right? I'm sure my wife doesn't want me to have this issue, right? But I want natural ways to do this because these drugs have scary side effects. So this is some of the common names: Viagra, Levitra, Cialis. And this is not a big deal. If you get on these drugs, worstpills.org tells us that we might just lose our hearing or our vision, right? So you can get an erection, but you may be blind and deaf. But is that not insane when you start putting some of this into?
Well, and this is the thing is that if you add the Vasconox, which is a nitric oxide, and you add this together,
so powerful.
We've seen some when you talk about that together, we've had a lot of talks about that side of things because many people, once you start to balance your body better, then this is things that, drugs, in my opinion, can be used when you are in a stage where you absolutely, right? And so,
and with the proper monitoring, right?
Yeah, of course.
So PDE5 inhibitors, basically they create vasodilation. And so we want to do that again. I want to figure that out.
And this was prescribed this was set up as a cardiac drug first and accidentally became a benefit to that.
Yeah. And so improving penile blood flow and increased oxygen, right? That again, this does this a little bit different than the Vasconox. That's why together they're so powerful. If every human on earth was on those two things, balancing hormones and improving nitric oxide, I think we would have a completely different health as a world, to be honest. When you've seen these work in real time, it's pretty cool. So PDE5 inhibitors, they're not just for erectile dysfunction. There's research showing that PDE5 is essentially throughout our whole body. It affects all of our organ systems, okay? So we don't want too much PDE5, especially since they're finding out there's obesity issues with it, cancer issues, right, with excess PDE5.
Mhm.
So that research isn't super clear yet, but they're finding PDE5 throughout the rest of the body. And so in excess, it will create some other problems. They just haven't learned about it yet. So this is an example of how PDE5 affects a uterus, right? It's throughout the whole smooth muscle system that we have too much PDE5 in this uterus that's going to affect that negatively, right? So we want a PDE5 inhibitor, whether I'm eating it or having food molecules. So this is pretty cool. So this is Testosterone. So Viagra is simply one of these four sections here, right? It simply is a PDE5 inhibiting enzyme, like the green rectangle there. So it has one benefit. You get on that drug, we see all those side effects. You need more and more of it because it is a drug. You build a tolerance to it, but it just does that one mechanism. Testosterone has been shown to provide these four mechanisms for erectile
Improving
dysfunction.
nitric oxide, super important. Obviously, what we're talking about today is elevating testosterone and then obviously improving intracarbovenous
Yeah.
pressure.
So
So that's,
do you think if your patients saw what Viagra does mechanically, right?
of course,
Chemically, and then they're like, this is cheaper, by the way. This has four different positive mechanisms. Which one do you want?
of
What are they
course.
going to choose,
Yeah,
right?
yeah.
But people don't know about this, and that's why we're sharing it. So this was an 8-week study we did with Testosearch. We basically saw significant body composition changes over 8 weeks,
Yeah.
and hormonal changes. So you can see, you know, I like testing, I like diagnostics. That's how I've confirmed a lot of the stuff that we do, including the Vascanox.
Yeah.
So you can run tests on yourself, you know, before you get on this, maybe create a 2 to 3 month fitness plan, get on Vascanox, get your help with some labs, take the Synergy and measure, and let's see what happens, right? The diagnostics don't lie. And this is why I'm so convicted in this process now, as it works so well.
Yeah.
Here's a clinical study, again, on the 8-week body composition, basically showed a significant impact on body fat percentage and an improvement in total and bioavailable testosterone just in 8 weeks.
Yeah.
But again, I tell patients, take it for 2, 3, 4 months before you judge it. And then the ones that have come up to me out of literally hundreds and thousands of other doctors, the ones that are like, I didn't really notice much with it, you know, maybe 2 months later, I start asking them questions because I don't know if they were expecting a TRT reaction where they just turned into superhuman all overnight. But I ask them like, oh, really? Let me ask you a few questions. You know, how's your digestion compared to 2 months ago? Oh, I guess that's a little better. How's your blood sugar? Oh, yeah, I guess that improved a little by my last labs. Now, how's your sleep? Oh, yeah, I'm only getting up 1 or 2 times at night versus 5 times, right? That's usually an inflamed prostate. So when you start asking the right questions, they start to realize, oh, yeah, this has helped me.
Yeah.
But right, when we start taking something, we get this different distorted view of what it's going to do to me, right?
Yeah.
So you have to be realistic. This is food molecules. It's always going to help you. It's never going to hurt you, right? So we just have to be realistic with what we're comparing it to and run the right tests if you want to test. And we talked about this earlier. It's a safe supplement. It's safer than your last restaurant meal when you look at the chemicals in it.
Yeah.
So take it. If you don't want to get tested, cool. It's a safe supplement we could have on Walmart's shelf or anywhere in the world, right? But we want this in practitioners' hands because it's so powerful.
Of course.
Or we get a free saliva test, right? The accurate way to check what your testosterone is actually doing in the body. I like saliva testing. There's other ways to do it, urine, right? I like saliva because it's easy. A patient can spit in a tube. We can send it off to the lab. They take it between 6 and 10 a.m., right? Because that's when the most testosterone's in the body. And then they follow up on that maybe 60 or 90 days later. What that tells us is the free testosterone. Remember, of that big chart, the 2 to 3% is what makes me feel good or not.
Yeah.
So that's what we want to track the progress of. And if you're low normal, usually we see that come up over time. If somebody's out of range, usually we see that come up over time. And when a woman has a really high testosterone number, remember, we have a lot of conversions happening. So if you want to check DHT, if you want to check, you know, the estrogen, the free progesterone, all these different things, you can start to see the magic of all these mechanisms versus most people get so locked in because of the mainstream dogma of testosterone. We just want a high total testosterone, but it doesn't work that way.
Yeah. Well, obviously going to show how we can get this product here as well. And, you know, I know you got some other slides here to talk about how you can do that. So I'll let you finish up with going through some saliva tests on some. But if anyone has any questions, I know there are probably quite a few, but I think you've done a great job explaining this all. And, you know, I had the privilege of going through this a little bit before with you. But if you have any questions, put them in the chat. Even email us afterwards, and we're happy to go through some of those things with you as well. So,
yeah. And I'll make this quick now. So overall, I've partnered with a biotech company. That's how we create these best-in-class formulas in the world now. We have 214 granted patents, 35 human clinical studies, 72 peer-reviewed publications. Like I said, you won't find anything else with this many certifications. Efficacy, safety in the world doesn't exist. That's why I partnered with them. So we have the safety studies. So this is safe. This is, again, safer than your last restaurant meal. I like to tell people that because they don't realize what's in that food. And it's safer than herbs too. Herbs are hard to standardize. So a lot of people have heard of like Fedosia, tongue for helping testosterone. This is so many more mechanisms working together, but herbs are hard to standardize. If I take one company's herb today and the same herb in 3 months from the same company, it's going to act differently in the body. But because this is food, we can DNA authenticate it. It's the same exact thing in every capsule. So there's no volatility. And again, herbs do have side effects and interactions. So we've compared it to everything. You won't find anything else like this. More published studies, clinical studies. It's 100% natural, certified informed ingredient, highly standardized for accurate dosing. Like any way you look at it, it's just the best out there that you will ever find. So real quick, that's a lot of stuff. I hope people are engaged. It's so exciting.
I think this information is so valuable. Like, and I can't stress this enough, you know, for our listeners out there is that when we talk about heart disease, balancing your hormones is so important. It's like, it's top. And that's why we test it in our clinic, because it can be a marker. And then, you know, if you are at risk, we want to find out why you're at risk, right? And so this is one of those pillars that we look at, and it's so important. So yeah,
I'm excited for you guys. And so one of the other ingredients, so we just talked all about Testosurge.
Yeah.
All of those mechanisms, all the safety, that was Testosurge. Okay. When we added something called Hyperox, it was a game changer. I had used Testosurge by itself with many people over the years. When we add the Hyperox, it works just synergistically better. We have a clinical study on Hyperox showing it actually improves your ejection fraction. I don't know if you want to explain what that means.
Yeah, and that's the heart functioning. So when we talk about heart disease, the most important thing about your heart is to make sure it's moving well. And, you know, ejection fraction is making sure the heart is moving well. Now, for those people that are in heart failure, that's where it's important to be able to improve that side of things.
So the synergistic blend of putting that natural ingredient that's also certified just like this, it was a game changer. So it works even better than by itself. All right, so they can go to the website, get more information. You can get them the research, some of the studies. But again, I like to talk about this with all my patients. This is a daily ritual to end up more like the person on the right versus the left. These women are the same age. The difference is not genetic. Our genetics have not changed in the past 100 years. It's epigenetics. It's our daily choices. Every bite of food we eat, every movement we do or don't do, the amount of sleep I get, the thoughts in my head. Literally, being healthy is not easy when you look at it, right?
Of course.
But I want to make daily choices so I'm around for my grandkids, right? Choose your heart. And so this is just an example. Like we have a choice. This is just 40 years of different habits. That's all it is. There's no excuse. We all have excuses, but you know, you need a bigger purpose, I think, right? I do this for my kids, for our patients. If I'm not living and breathing what I'm practicing and preaching to them, who the heck am I? I'm just selling products, right?
Yeah.
So we all have to make decisions to do this or not, and it's not easy. But if you change nothing, nothing will change. We all know that. We think about that most every day. And this is the website. So we do have a limited quantity. I don't know if you want to talk about that.
Yeah. So Dr. Tim's left a little bit. I think you said you only had a couple hundred.
We have a few hundred.
Yeah. And so, you know, we're bringing this, of course, up to Canada for you guys. But if you want to order it, of course, you can go right on the website and order it, or you can call us at the clinic and we can order it for you. But my recommendation would be to order 3 bottles at a time, so that you can trial that out and make sure that's working for you as well. Again, it's just having good foods that are making your testosterone higher, and that's and we showed that already as to how that works. But yeah, that's the website, heartfit.optimal-t.com. And
we always get dosing questions, so just let me cover that again real quick.
Absolutely.
So minimum, take one of these at bedtime. My 14-year-old daughter takes one of these at bedtime. If simply it just stopped her body from converting her natural testosterone into that aromatase that contributes to breast cancer, if it just did that for her, it's worth the $2 or $3 a day, right? So my daughter takes it. It's not going to mess up her hormones. It's only going to balance them. So minimum, all humans 18 and older, take at least one at bedtime. Just optimize that morning release a little bit better. Better than eating super healthy foods. It's just going to act more powerfully.
So it's better to take in the nighttime.
Always take it at bedtime. Yeah. Because remember, we want to optimize that morning release of all of our testosterone. We all already do.
And then for those that are low, it would be 2 a day.
2, you could even do kind of the max. There's no maximum. If you took 10 of these a day, it's not going to hurt you, right? Yeah. But for people that have really low numbers or a lot more symptoms, maybe their blood sugar's out of balance or cortisol levels, we've seen this have influenced so many things in the body. Yeah. I would do 2 at bedtime and then another one at like 11 a.m. because it gives those people that get really tired in the afternoon a little extra boost.
Yeah, you
But
can
when
try
I,
that out and see how you
yeah,
feel with
but when I
it.
do those 3 a day, 2 at bedtime, 1 at 11,
Yeah.
I only do that for a couple months. And then it's like, all right, now just do the 2 at bedtime. Eventually, as you're tracking your numbers, if you want to do that or you're feeling better, you could just minimum, at least take 1 at bedtime to help optimize that synergy.
Of course. There you go. Yeah, so if you guys have any questions, of course, you can message us there and we can go through. I'm going to just stop sharing this. I see we got lots of people still on the webinar. I know there's a question dealing with long family history of heart disease, 62 years old with high cholesterol that cannot be controlled with statins. Interesting. And very healthy, get a lot of exercise. What's the answer? And so I think it's, if you have high cholesterol, I don't always see that as the problem for heart disease. So when I talk about that, number one, what's your risk? I think that's key. Understanding what's inflaming, if there's any inflammation to the arterial wall, and understanding particle sizing becomes important. So I think that would be my answer there. And then if you are at risk, and we want to get into the why, and that's where hormonal imbalances are important to look at. And so we can test for hormones and to see what's happening on that.
And inflammation, right? And
Yeah,
I mean, there's so many things to affect my health. So even if somebody has really high cholesterol, but the rest of their body's really healthy, really nothing's going to happen with that, right?
Yeah, of course.
So it's really about finding all those blind spots in my body that I need to optimize, like micronutrients and otherwise.
Yeah. And I think it's very important to be able to look at all those type of things as well on that end of it. I lost my chat here. Here we go. How does your product compare to I'm not even heard of this one.
I haven't heard of that either.
Yeah. So I can't even go. I think Dr. Tim did a really good job of explaining the mechanism of of what we're trying to do and obviously the benefits. I've looked for a lot of supplements and I couldn't find anything that does what we're looking for it to do in a natural way. And so anyway, this is why I really like this one on that.
Maybe they can email you about this. I can look it up, but I've researched everything. I've compared this to everything out there. I work directly with the biotech researchers and scientists. We're literally making sure we have the best certified, clinically studied stuff on Earth compared to everything else out in the world. So I'm confident we can get an answer for that.
If you want to, you can unmute yourself and ask a question, or you can, again, type it into the chat there as well. I want to, I know we took a little bit over an hour today, but I want to thank your time. Your time is very valuable, and I want to thank your time for being available to ask. I think you went through it so well that even my questions that I had prior to going through it, I'm like, I don't have any.
Yeah.
And so, and it just shows to how well you did a good job of explaining it very well and explaining the different mechanisms. I think that one slide where it shows all the 5 different ways that you can get testosterone. I mean, by all means, those are options after you consider this, right? And that's where I always look at it from that perspective. So, so if you, maybe I'll stick around for a couple seconds. If there's any questions, you can feel free to unmute yourself and, or use the chat bot, the chat bot. I'm so used to this AI world that we're in. But I think even AI wouldn't even come up with that many questions because I think you did such a great job of explaining things today. And so, yeah, I'm going to, I know we've had a long day today. And so I'm just going to say thank you. And if there's any questions, feel free to email our team, connect with us. We'll get them answered. Obviously, we have connections to some of the best people dealing with hormones in the world, I'm going to say. And we're very excited to be able to have Dr. Tim. He's a busy guy. And so thank you I had to catch him on a day where, we were going to be in the conference together. And so that's how it ended up being. That's why we're here together in Florida. So that's how it worked out really well.
Well, if there are a lot of questions, you guys can gather those. We can address all of those at some point.
We'll send the link to you guys via email. And thank you very much for your time today. I hope you found it very valuable. And thank you again, Dr. Tim, for being here today.
Thanks
thank you very much and have a good night.